Hello everyone and welcome to our presentation today. We are biomedical science students from Middlesex University. My name is Iman.
My name is Warta.
My name is Gina.
My name is Shaida.
My name is Pirshi.
My name is Nima.
And this is our presentation on fungal infections. To introduce the topic today, I will explain to you what fungi is. A fungus is a member of a large group of eukaryotic organisms that includes microorganisms such as yeasts and molds. A fungi can either be unicellular or multicellular. They have a separate kingdom in biotaxonomy due to their differentiation from plants, animals and bacteria. This difference can be seen in the cell wall that contains glucan and chitin, instead of cellulose found often in plants and protists. Its lack of chloroplasts requires alternative energy sources. These structural differences were not identified until Anthony van Leeuwenhoek invented the microscope in the 17th century. This was followed by Pier Antonio Micheli's study in 1729, in which he not only observed spores, but also showed that under the proper conditions, they could be induced into growing into the same species of fungi from which they originated. 2 centuries later, Alexander Fleming developed the first antibiotic called penicillin. He observed a clear zone in which the mold inhibited the growth of Staphylococcus aureus that he cultured in a petri dish overnight. Fungi perform an essential role in the decomposition of organic matter and have fundamental roles in nutrient cycling and exchange. Saprophytic fungi digest and absorb nutrients from dead organic matter, whereas parasitic fungi absorb nutrients from living tissues. Some species grow as unicellular yeast that reproduce by budding or binary fission. Dimorphic fungi can switch between a yeast phase and a hyphal phase in response to environmental conditions, seen here. The optimum temperature being 35 to 40 degrees, making the human body an optimum environment. When fungal spores from the environment gain entrance to a warm-blooded animal, they germinate into yeast and remain in this phase in the host. Yeast cells leaving the animal host return to the environment and revert to the sporulating hyphal state. These conversions can be demonstrated in artificial media in the laboratory. The optimum temperature being less than 30 degrees for hyphae in its natural habitat.
Mycosis is an infection or disease caused by the invasion of any fungus into the tissues of a human body, which may lead to either superficial, subcutaneous, or systemic disease. The clinical name of mycosis depends on the site of infection on the body, the route of entry acquired by the pathogen, and the type of virulence utilized by the fungus to invade the host tissue. Superficial mycosis are fungal infections that are limited to the outermost layer of the epidermis, hair and nails, including the mucous membranes, which may involve some degree of tissue invasion. Cutaneous mycosis are fungal infections that extend deeper into the skin but are limited to the keratinized layer of the epidermis, hair and nails. The majority are caused by 3 groups of fungi called dermatophytes. Subcutaneous mycosis are chronic localized infections involving deeper layers of the skin, including the cornea, muscle, connective tissue and adjacent bones. Systemic fungal infections originate in the lungs before disseminating to other organ systems within the body. Such infections may be acquired as a result of inhaling spores of organisms that obtain nutrients from dead organic matter to grow in the environment. This is an example of subcutaneous infection. Mycetoma is a chronic subcutaneous infection caused by acetonomites or fungi. This infection results in a granulomation, inflammatory response in the deep dermis and subcutaneous tissue which can extend to the underlying bone. Mycetoma is characterized by the formation of grains containing aggregates of the causative organisms that may be discharged onto the skin surface through multiple sinuses. Systemic mycosis due to primary pathogens originate primarily in the lungs and may spread to many organ systems. Organisms that cause systemic mycosis are inherently virulent. In general, primary pathogens that cause systemic mycosis are dimorphic. Systemic mycosis due to opportunistic pathogens are infections of patients with immune deficiency who would otherwise not be infected. Examples of immunocompromised conditions include AIDS, alteration of normal flora by antibiotics, immunosuppressive therapy, and metastatic cancer.
Looking at the number of cases by the distribution of Candida species in hospital wards, it is evident that the number of cases related to Candida albicans specifically is increasing rapidly in surgery wards and intensive care units, which indicates that there is a link between open wound surgeries and the rise of opportunistic fungal infections.
In the event of an infection, the body responds in a fairly predictable manner, involving the migration of inflammatory cells. white blood cells to the infected site in order to remove dead tissue. Fungal organism. The repair of infected or damaged areas by the production of granulation tissues composed of macrophages, fibroblasts, collagen, and capillaries, and the replacement of granulation tissue with fibrosis tissue, also known as scar tissue. Cellular responses to fungal infections are not often produced in immunocompromised patients due to immunosuppressive drugs or an immunodeficiency disease. Otherwise, granulomatous reactions are commonly observed in tissue suggestive of fungal infections. In addition, the etiologic organism may be observed in areas of tissue where inflammation is the most prominent, with the presence of many inflammatory cells.
The fungal pathogenesis of humans requires a portal of entry. These can be one of three things: superficial, contamination of skin surface; subcutaneous, infection can be acquired by fungal organisms that inoculate into the skin as a result of trauma; and systemic, i.e., the inhalation of spores affecting organs within the body.
A common superficial infection of the mucous membranes is caused by a yeast-like fungus called Candida albicans. This is a common cause of vaginal infections, producing symptoms of itchiness and vaginal discharge. Pregnant women taking oral contraceptives pills are more susceptible to Candida infections, as are individuals treated with broad-spectrum antibiotics such as tetracycline. A number of antifungal drugs are available that can be applied locally to treat infections caused by dermatophytes and Candida. The fungus Candida is a genus which causes infections subcutaneously and systematically. The most common example of subcutaneous infection is mycetoma, which is characterized by the draining of the sinuses, whereby the discharge contains granules that vary in size, color, and degree of hardness. Systemic infection can, however, occur either as primary pathogens or as opportunistic pathogens. Primary pathogens originate from lungs with chronic symptoms such as cough, fever, malaise, and weight loss. Opportunistic pathogens, however, infect individuals with immunocompromised conditions such as AIDS and metastatic cancer, to mention a few, with symptoms including fever, cough, and pleurotic pain.
Diagnosis of mycotic infections is performed by direct microscopic examination of specimens, culturing, serological testing, and histopathological testing. Depending on the fungal species and the location of the fungal infection, a series of tests may be performed. This includes inoculating of specimens on agar plates, such as blood agar, which is incubated for a set amount of time to isolate and identify the causative agent. Potassium hydroxide can also be used to mount the specimens so that they could be identified under a microscope for identification of fungal elements. Histopathological testing can also be used to identify fungal elements on tissue biopsies. Staining includes PSA staining and silver methylene staining. The main treatment for fungal infections is antifungal drugs, immunosuppressants, and surgery. Chronic or progressive systemic fungal infections can be treated with a variety of antifungal antibiotics. A 40-year-old diabetic patient was admitted to hospital with symptoms of cough and fever. A chest x-ray revealed a large consolidation in his left lung. A bronchial biopsy revealed non-specific chronic inflammation, but cultures revealed growth of blastoma stomatitis. This patient responded to treatment with antifungal antibiotics.
Antifungal drugs work by either disrupting the plasma membrane and cause leakage of the cytoplasm, or interference with ergosterol synthesis, leading to defective cell membranes, or inhibit an enzyme in ergosterol synthesis.
Subcutaneous infections are difficult to treat and may require surgical intervention, such as debridement. Debridement is the medical removal of dead and damaged infected tissues to improve the healing potential of the remaining healthy tissues.
Simple methods to prevent the spread of fungal infections. Firstly, to prevent athlete's foot, you need to make sure that you wash your feet after you shower and make sure that your feet are thoroughly dry, and make sure you wash socks. Second one, to prevent nail and skin infection, make sure you wear gloves when doing the gardening to prevent nail and skin infection. Share combs, because that can lead to scalp fungal infection. Make sure that you change your toothbrush. If you find that the bristles are sort of overused, make sure you change your toothbrush. Also, there are special creams, powders and lotions out there to prevent fungal infections. And finally, don't share clothes, and if you do, make sure they're washed.
From this presentation, we have gathered that opportunistic fungal organisms are responsible for the increasing prevalence in opportunistic fungal infections. Although the use of a combination of antiretroviral treatment has proven to be the most effective method for opportunistic fungal infections, researchers are still yet to develop fast and cost-effective clinical tests for diagnosis of such conditions.